Hi, my name is Anika. I'm a student volunteer at Apne Aap, and today I'm here with Ishita Panwar, a student volunteer from Ahmedabad University. We're going to be presenting on the impact created by Apne Aap's 1 Million Meals initiative. The report was written both quantitatively and qualitatively to analyze the results of Apne Aap's 1 Million Meals, and today we'll be presenting on the most important points. So for a little bit of background on how hashtag 1 Million Meals was initiated, it started in response to a WhatsApp message that Ruchira received from a girl who had been sent home from school to the red light areas when the lockdown started. Her mom, who was transitioning to daily wage work, lost all income, and this cry for help, among many others, is what initiated the 1 Million Meals project. So this started as a stopgap till government systems were set in place to address food insecurity, but these systems are yet to be set in place, and Apne Aap has continued with 1 Million Meals for over 18 months. So starting with around 800 families on March of 2020, we have scaled now to 123,000 families as of June of 2021. This has amounted to about 12.3 million meals as of June of 2021. So now I'd look into the model that has helped the 1 Million Meals campaign both scale and sustain. It's been the human change. So starting at the top with Apne Aap's leadership and Ruchira Gupta, with many links along the way, including celebrities, donors, shopkeepers, student volunteers, NGOs, and then all the way down to every last girl, which is the beneficiaries. Now for a closer look into one of the links of our chain, we have the NGOs supported by Apne Aap. So Apne Aap has supported around 27 NGOs all over India through the 1 Million Meals campaign, and this has helped them reach the most vulnerable communities. Now for a more concrete look into when we were reaching these beneficiaries. So in June of 2020, we reached around 75,000 beneficiaries, and this was when the first wave of the COVID virus was at its peak in India. Now, if we take a look into 2021, in June, we reached 150,000 beneficiaries, and this is once again when COVID was at its peak. So for a breakdown of these beneficiaries, about 0.15 million were women and about 250,000 were children. Now, if we take a look at the meals distributed, so we distributed around 12.32 million meals as of June of 2021, and that amounts to about 123,000 ration kits, and the largest amount was going to both West Bengal, Delhi, and Haryana. I'm now going to pass it off to Ishita to continue with our numerical impact and to give us a look into some of our government recommendations.
Yes, sure. So there are many women in India who still use cloth and consider using it safe. So Apne Aap has done a great job to reaching out to many states and distributing sanitary pads, which amounted to 0.25 million in total. And these were distributed between March 2020 to June 2021 in some of these states, as you can see in the graph. And here we see is the pie chart showcasing the impact on children that Apne Aap has had and how many children it reached out to. Because many children have been abandoned by their parents in the red light areas. Along with this, there was very little government support that they received. Also, not just this, but they did not have the required resources to continue their education. Hence, they were in a very vulnerable state. And here, as we see, is the pictorial representation of what a single ration kit comprises. It has 12 very basic yet essential items. And now we come to the government recommendations owing to the COVID-19. First is to re-establish affordable and accessible decentralized healthcare systems to ensure that migrant populations and informal sector workers are included in the national and regional post-pandemic recovery measures. Second we have is that government should really tie up with the NGOs and local retailers and wholesalers. So this would provide for a faster network of food distribution. Third, we have is the implementation of new fiscal policies. We can take up examples of countries like the US, Australia, and China, where they have implemented the policies that had fiscal measures to help the vulnerable, to financially support actually. And also they had conducted efficient vaccination drives. Fourth, we have is providing economic stimulus and unemployment benefits to people who are daily wage earners. Next up, we have to empower the essential workers like nurses, doctors, and PHCs, and providing them with adequate healthcare supplies so that they could further on help people. Next up, we have COVID-19 awareness campaigns in multiple languages and through various mediums like radio announcements, televisions, etc. This would actually sensitize people about the effects of COVID-19, and they would henceforth take the preventive measures. Next, appropriate channels must be intended to guarantee that passes, food collection, and donations are distributed and made available to beneficiaries. Last but not the least, childcare services must be empowered to help vulnerable children. Here, as you can see, we have some quotes that reflect how happy and grateful the beneficiaries are for the help extended by Apne Aap. Apart from food and nutrition, the organization has tremendously helped children with getting access to education. So here we have is a senior-most student from her community. She says that the organization helped her get a hostel facility, got her enrolled in the school, and helped her with the groceries and rent. Next we have is Mr. Rahman, who works as a street magician. So COVID-19 affected not just him, but all the families in his community. But he's very grateful for the help extended by Ruchira ma'am and her team in this difficult time. Thank you very much, all of you present here, for being a keen listener to our presentation. We will be very soon releasing the in-depth report of the impact that Apne Aap has had on various beneficiaries. So stay tuned.